Hi, everyone, and welcome to today's ALNAP Urban webinar. I believe this is the 20th urban webinar we've ever done. We started the series in 2013, and we do a few of them every year. So great to have you all with us, and hello to everyone who's joining just now. My name is Leah Campbell, and I am a Senior Research Officer at ALNAP, which is a network of humanitarian organizations focused on learning. We started this webinar series to provide a space to hear from different organizations working in urban contexts to share practical experiences around areas where lessons still needed to be shared and learned. So each webinar focuses on a different topic, and today's is about protection in urban humanitarian response. Shortly, I'm going to introduce our speakers to you, but before I do that, we're going to also put up a poll so that we can find out a bit more about who is in the room. So have a look at that poll while I'm reading out our speaker bios, and so then we can get a sense of who all of you are. There'll also be a survey for your feedback at the end of the webinar, which we ask you all to share with us. We look at the results of these very closely and try and take on feedback for future webinars. So please do have a look at that when it pops up at the end of the webinar. So we have two speakers with us today. I'm going to introduce them to you now, and then we'll hear from them a presentation. We'll also then have time for your questions. We'll start with questions which were submitted in advance, and then we'll also take your questions live. So who are our two speakers? First, we have Angela, who is the Global Advisor on Internal Displacement with ICRC. Angela has worked for the ICRC for over 15 years in various capacities in Serbia, Colombia, Kenya, Sudan, and Geneva, where she's focused on the protection of civilians and others affected by armed conflict and violence. In her current role, she leads ICRC's reflection on strengthening protection for internally displaced people through operational and policy engagement, and she co-authored the ICRC's Displacement in Cities report, which she's going to talk to us about today. She's also published on topics related to urban internal displacement and implementing community-based protection approaches in displacement settings. She is trained in political science from the University of Florence and holds a doctorate in international law. Then we also have Heidi Sadiq, who is head of media at Sea-Watch, which is a rescue NGO responding to the humanitarian emergency in the Mediterranean. At Sea-Watch, she acts as a spokesperson and representative while also looking after the coordination of protection activities in this context. The experience Heidi is going to share with us today relates to her role as a project manager with MedAir, where she oversaw the design, quality, and implementation of a pilot project in Amman on urban protection, which delivered a combination of multi-purpose cash and multi-sectoral case management for both Syrian refugees and vulnerable Jordanian households. Previously, Heidi has also worked for Save the Children, Restless Development, and she also set up a small UK-based NGO. Heidi has a BSc in Human Geography and International Relations, an MSc in International Development Studies from the University of Amsterdam, and an MA in the Politics of Conflicts, Rights and Justice from SOAS in London. So welcome both to Angela and Heidi. Before I turn over to them, we're going to share the results of the polls. So we have a bit of a mix of all of you on the line, and there are about 120 of you so far here with us. 41% of you don't know much about either protection or urban context, so you're in the right place because we're going to talk about both of those things today. 43% of you have a specialism in protection but don't know much about the urban context. 13% of you have a focus on urban but don't know much about protection, and 3% of you are experts who we really should have contacted to speak on this webinar, so apologies for that. Hopefully we can still share something new with you, and by all means, as well as your own questions, everyone is free to share their own reflections and experiences using the chat functionality. My colleague here at ALNAP, Grace, is on the line to answer you via the chat and let you know that your questions have been taken into consideration. And also hear from ALNAP behind the scenes is Cara, our comms officer, who has designed all of the graphics you'll see in the presentation, and will be making sure that we all run smoothly today. So I'm going to turn over now to our first speaker, Angela, who's going to share with us her presentation on protection in urban displacement settings. Over to you, Angela.
Thanks very much, Leah. So, yeah, very nice being with you all. So, I'd like to share some reflections on the challenges of protecting internally displaced persons, IDPs, in urban settings outside camps, as emerged from a study that the ICRC published last year. And this will give me the opportunity to discuss protection in different types of urban displacement contexts, cities at war, cities of refuge in countries at war, and cities affected by urban violence. Next slides. So the ICRC displays in city reports stemmed from the awareness that internal displacement is increasingly urban. Next slide, please. But little is known about people's experience of displacement in cities outside camps, and improvement are still required to address their needs. Anyway, the report is based on case studies in Maiduguri, in Nigeria, Baidoa in Somalia, thanks, Mosul in Iraq, and San Pedro Sula in Honduras, interviews with key informants, and a literature review. It considers the perspective of urban IDPs and their hosts on their situation. It examines the humanitarian response, identifying inspiring approaches and challenges, and it reflects on how to strengthen the response. We found three main shortcomings in the typical humanitarian response to urban displacement outside of camps. First, a focus on camps when camps exist, even though we all know that many people do not settle in camps. Second, a gap in both the emergency response and the longer term response. That is, urban IDPs outside camps very often don't receive support and struggle to meet their basic needs. And when support is provided, it tends to focus on people's survival, thus falling short of helping them to rebuild their lives and to restore a sense of dignity. And third, an over reliance on blanket responses versus individualized responses, particularly in situations of armed conflict. And this means that IDPs' specific needs often remain unaddressed. Shortcomings in the humanitarian response are often attributed to the scale and complexity of cities, the rigidity of planning and funding schemes, lack of understanding of the role that humanitarian can play in such settings, and the limited urban expertise. We argue in the report that shortcomings also results from the fact that responses are built on unverified assumptions. For example, it is commonly believed that IDPs outside camps are better off than those in camps because they're hosted by relatives or can afford to pay rent. And this explains the focus on camps and the gaps in the emergency and longer term response. It is also believed that IDPs outside camps are difficult to reach, leading to blanket responses rather than individual ones, and that IDPs outside camps are face the same problems as urban poor, and hence again blanket responses. These assumptions may be true in some cases, but are not universally true, but still they inform the response without being assessed against the local reality. Our study has shown that people experience, of course, is influenced by different factors, including individual characteristics such as gender, age, and capacity, but particularly it is shaped by their location and pattern of displacement. And the challenges of protecting people vary depending on whether they find themselves in city on the front lines of armed conflict, in a more stable city in a country at war, or in a city affected by urban violence. Civilians trapped in a city at war, think of Mosul or Aleppo, are often in a life or death situation. Protecting them involves striving to limit the impact of urban warfare on their lives and property, but also on interconnected urban services upon which people are highly dependent for their well-being: hospitals, schools, water installations, and electric plants, for example. Protection in a city at war requires working to strengthen respect for international humanitarian law, by all parties to reduce people's suffering, to help them avoid displacement. But it also requires efforts to ensure that the people can flee safely to a more secure location, because living may be the only way that people have to avoid imminent danger or hardship. So it is important to build a protection dialogue with all the parties to the conflict, but in our experience, it's also important, where possible, to engage directly with communities at risk ahead of military operations to help them better prepare for the eventuality of displacement. And lastly, a city at war today will become a city of return tomorrow once the fighting is over. So, although the focus may be currently on emergency responses, protection efforts must be informed by durable solution considerations. It is important to anticipate possible obstacles to future returns, such as destructions of homes or weapon contamination. As far as cities of refuge for military operations are concerned, so protecting IDPs in these settings, think of Maiduguri, Baidoa, or Bogota, poses a different set of challenges. Access per se is normally not an issue. The difficulty for humanitarian actors comes from dealing with a large influx of people living dispersed within host communities and facing multiple needs, some of which are specific to them and others are shared with their hosts. So, how we locate IDPs, how to decide whom to prioritize in the response to ensure the meaningful participation of IDPs and host communities, both in design and implementation of responses. Protection concerns of IDPs are less obvious here than in a city at war. They typically result from inadequate domestic frameworks, lack of access to document, stigmatization, tensions with host communities, and economic insecurity too, because the lack of livelihood fosters harmful survival strategies such as child labor or transactional sex and contributes to the risk of forced eviction. Thus, it is needed to have a broad prism of analysis to understand IDPs' vulnerabilities and protection concerns. Response-wise, the focus must be on supporting to IDPs to rebuild their lives in the city by intervening at different levels, individuals, host communities, municipal and central authorities. In particular, engaging with authorities on durable solution is key to ensure that IDPs local integration is facilitated as a possible option, in addition to voluntary return, and to avoid people facing pressure to go back to unsafe or to premature circumstances. In cities affected by urban violence, the first challenge to ensure protection of people who are displaced within or to the cities is their identification. This is in part because internal displacement that is related to um, urban violence as a gradual and individual nature. It happens gota gota, as they say in Central America, as opposed to mass displacement in conflict situations. And also because people fleeing targeted violence by gang members often choose anonymity as a self-protection mechanism. They keep a low profile, reduce their movements, avoid to approach the authorities out of fear of being pursued by the armed group who caused their displacement in the first place. In these situations, do no harm considerations must be incorporated in all efforts to locate IDPs and to engage with them. Specific challenges arise when authorities are reluctant to recognize urban violence related displacement. And of course, challenges are there for when it comes to dialogues with gangs, because engaging with them on protection issues, is usually very difficult. And this limits the possibility to prevent the conditions that cause people displacement in the first place. Um, Return home is hardly an option for IDPs in these settings. Local integration can be a solution for those IDPs who can find relative security in the new place. But for some, the nature of the individual threat that they face means that they may not find protection anywhere within the country and may need to be helped to move abroad. So, a good understanding of the different profiles of cases is necessary to anticipate the difficulties people may encounter and to try to adapt the protection response accordingly. Another specificity in these urban type of urban settings is the overlapping between communities of origin and host communities, because people often move within the same city from a violence affected neighborhood to another controlled by the opposing gang. This creates opportunities in terms of establishing synergies, constructive links between the response to IDPs and a broader urban violence response. For example, community projects in violence affected neighborhoods can facilitate identification of IDPs within the community who may need specific support. At the same time, it may be difficult for humanitarian actors working in the community to help persons at high risk to leave and to relocate elsewhere, because these may trigger security threats by the armed group controlling the neighborhood. Let me share some lessons learned from the ICC experience in Central America. So what is needed for the response to urban displacement, to urban IDPs in this type of settings in cities affected by urban violence to be effective? First, establishing a local network for case referral and support can facilitate identification of highly vulnerable IDPs and addressing their multiple needs. In this regard, of course, cooperation and coordination with local authorities and grassroots organizations, national Red Cross or Red Crescent societies, church, community leaders, etc., and other relevant actors is key. It requires a clear understanding of respective mandates, working modalities, and criteria for support. And providing feedback on cases that are referred to us by other actors, organizing working sessions to share expertise and experience has also proved valuable to foster a shared analysis of the problems and also of the role that each actor can play. Second, lessons learned, psychosocial support and livelihood support contribute to IDPs protection in the longer term by helping them rebuild their lives. If IDPs who are safer in the new location can access employment or start a small-scale business, they won't need to resort to harmful survival mechanisms, such as moving again to a more violent neighborhoods where rent is cheaper, or returning to safe circumstances, or resorting to irregular migration, for example. Third, individualized responses for the most vulnerable IDPs are keys, but they must be combined with a more structural approach aimed at supporting the authorities to develop an institutional response in the long term. This implies, for example, supporting the authorities to adopt and to implement specialized legislation and specific protection programs. We have also seen that acting as convener to facilitate forums for exchanges and coordination between the central authorities and municipal authorities may also be beneficial. And fourth, we need to develop community-based protection approaches that are adapted to context where communities are fragmented and distrustful, and where there are serious constraints that are related to access, to security, and the do no harm principle. It is it is hardly feasible to hold open focus group discussions on protection within a community setting where perpetrators and affected people live next to one another, and where affected people may therefore bear repercussions if they speak freely about their concerns. So people may need to be approached outside the community in a place that can guarantee their safety and confidentiality. By way of conclusions, through the study, we have identified 4 avenues for improvement. First, it is key to enhance engagement with affected populations. Humanitarian organizations have, of course, made a lot of efforts in this regard in the last years, but the practice sometimes steers away from that. And in part, this is because consulting people takes time and is feared to create expectations that cannot be met. What is particularly important is that given that it can be difficult to reach IDP in urban settings, we must look for ways of ensuring two-way access to also allow people to safely come to us, such as establishing hotlines, for example, or exploiting the potential of using information and technologies and social media. Second, focus on people's dignity and resilience. IDPs need to be supported before they become completely destitute and until they can resume a dignified life. This means that we must better articulate short and long-term interventions and approach emergency support and resilience building as simultaneous phases, elements and dimensions of the response rather than as sequential times of the response. And of course, as I mentioned before, we need to work at different scales through structural interventions and tailored responses. Third, responses must be built on a proper understanding of the situation of IDPs in cities and their impact on host communities. And fourth, it is key to team up. We need to ensure complementarity and coordinated efforts by humanitarian development organizations to support authorities and other central and municipal actors in developing a good response. Development organizations may be better placed than humanitarians to work with public authorities on structural issues, but often they're not in a position to address specific vulnerabilities at the individual or household levels, which is something that humanitarian actors can do. And humanitarian organizations may also have a well-developed capacity in areas that still remain out of reach for development organization. And last but not least, government engagement and ownership are crucial to achieve protection outcomes for IDPs. Thank you.
Great. Thank you so much, Angela, for that really interesting presentation. Before I turn over to Heidi, a quick reminder to everyone that you can submit questions throughout the webinar using the chat functionality, so please do so. We will turn over for our next presentation from Heidi.
Thank you very much, Leah, and thank you, Angela, for that interesting presentation, and everyone for attending. I hope that mine will give you a bit of insight into a specific project on urban protection in Amman, and I do invite the experts on these topics to also contribute so that we can learn together. I'll just be laying the context for this program before I explain how it worked. MEDER had been in Jordan since 2012, and so a couple of years in, with refugees from Syria being in Jordan for multiple years, we were well beyond the emergency phase. But there it's still, I mean, 85% of the refugees in Syria live outside of the camp settings in urban areas. And so there was a real setting of exclusion of refugees from national social protection structures. Even though they lived in the city among the host population, they were still largely excluded from many of the services available to them. The setting in Jordan is very cash dominant. Cash transfer programming is very popular modality there, and UNHCR has a special agreement with financial institutions as well to coordinate from assessment to delivery of cash programs. There is also a policy requirement in Jordan for 70% Syrian beneficiaries and 30% Jordanians. So that is also something to bear in mind when I explain the details of this program. Then there's also a bit of context on MEDER's previous programming there. Our biggest program was in healthcare, actually, and also through the cash modality by doing cash for health for emergency medical procedures and for safe deliveries for pregnant women. And then we also ran a multi-purpose cash assistance program for multiple years, where we found that the majority of the people spent their cash purely on rent. And basically for many people, it kind of felt like they had just arrived yesterday, even though they were there for 5 or 6 years. There were no opportunities for them to grow beyond that. So think of lack of access to legal documentation or further employment opportunities. And that's also where the policy changes were most needed. There were also, lack of protective measures more broadly because of the sole focus on providing people with cash, but not with, the autonomous and dignified ways to grow beyond that. So just a brief overview of the program that we ran. The reason that it was a pilot is that it combined the two modalities of cash assistance with case management for protection. We decided to run medium to long-term multi-purpose cash assistance to make sure that we move beyond, the idea that a burst of cash for 2 months is enough. Cash not being an end in itself, we decided to run that parallel to case management focused on protection in the following sectors: in healthcare, mental health and psychosocial support, legal awareness and aid, education and shelter. So really here, the multi-purpose cash assistance is still very much needed because people need to be able to pay their rent or pay for healthcare, but using that as a basis, as a building block for people to use for further opportunities for growth that is autonomous and dignified. Through case management, we decided it would be much more beneficial to take our time to build better coping strategies together with these households and to improve their decision making. So for example, if someone, rather than incurring debt on paying rent and risking eviction, we could help through the multi-purpose cash assistance for them to pay the rent, and then through the case management approach, help them to improve their coping, for example, taking a child back into school or understanding their legal rights as a household. So as I mentioned, a lot of the work happens under coordination of UNHCR, which also has a vulnerability assessment mechanism that is used across the board by NGOs. And here we decided to add a few elements of our own to really target the most vulnerable households in the city. So we focused on female single-headed households, households headed by someone living with disability or children who have disabilities, and people living with a range of negative coping mechanisms, like I mentioned, child labor, having high debts, working illegally, relying on early or forced marriage, or even asking strangers for money. So these were the criteria that we worked on, but we added a scale, so a red, amber, green scale with varying levels of vulnerability, which also affected the time frame of the multi-purpose cash assistance combined with case management. Then, dignity being the main focus of the multi-purpose cash assistance and the case management, together with the case managers, the family really took ownership of their case plan. And the case manager was enabled not just to do direct intervention, and by that I mean providing parenting skills, behavior change communication, or giving information about services in the area, but also to establish referral mechanisms in each of those sectors. Just a brief note on the state of this project at the moment. It began in early 2018 as a pilot to test, the combination of multi-purpose cash and case management together. And so the evidence, I've also left MEDER since then, but the evidence that I will be offering here is kind of anecdotal and also based on an interim report, but that can be made available after this presentation. So what we found is that access to healthcare and PSS still remain a serious unmet need. Over 75% of adults in this program were referred to PSS services. And there was also a very large element of integration in this program to other health services run by MEDER, so like the Cash for Health that I mentioned, or to other NGOs and UNHCR. Anecdotally, people have mentioned that the PSS element has really added capacity for them to cope with the trauma of war in Syria and the many years that they had spent struggling to make ends meet in Amman, and that it was a really like a missing piece of the puzzle for them that remained kind of neglected for many years of receiving cash assistance, but kind of being left alone to figure things out for themselves. Another very clear positive impact came from legal aid and awareness sessions that we ran with a large national NGO who did legal awareness sessions and provided legal counsel for the families that we worked with. This element of programming really added some evident, very strong economic and protection gains for the families that we worked with. So an immediate impact, for example, of having a rental agreement, understanding what the landlord needs to pay and what I need to pay would save people money, and they would be able to prioritize other basic needs and costs that come with that. And there was also a protective factor where people could retain their shelter and avoid unnecessary or even unlawful evictions. One of the learnings, which was quite difficult and where we had to redesign the program a little bit from the start, was the realization that multi-purpose cash and case management together, it's quite predictable and logical actually, but we found that it was most effective among those who were more in the green and amber categories because they were slightly less vulnerable, or at least that's how it came out in the scoring, and therefore they had some more of these building blocks to work with together with the case manager. Where it was more difficult for the most vulnerable in the red category was mostly the policy ceiling. That provided a real sort of dead end where it was much more difficult to come up with creative solutions and to tap into the services that are available to people because they are extra marginalized and vulnerable, and because simply policy does not allow for working in a particular sector or for taking up employment opportunities, and even for non-Syrian refugees, for example, who largely, fall outside of the radar. It was extra difficult, so that's outside of this program, to even, be considered for some of these protection programs. And that's also partially because of policy and a focus on Syrian refugees in programming in Jordan more broadly. Another lesson was to build in one-off emergency or contingency cash from the beginning into the design of the program, because people need to be able to deal with the unexpected blows that meet them in life. And so being, forced to go back to square one just because I had to pay for a delivery or because I got evicted, this part of the program basically used multi-purpose cash assistance as the basis, case management as a way to improve coping mechanisms, and then emergency cash to deal with any unexpected obstacles. Then the last and most important one is actually policy advocacy for protection programming, which seemed to not really be a priority for ministries who approve all NGO programming in Jordan. The need in healthcare was very clear, and many NGOs worked with MOUs with the Ministry of Health, for example, and that programming together with cash assistance was very popular, very well funded. But then there was a lesser inclination to fund and approve protection programming. And there was also a real need to do some advocacy with the National Aid Fund, for example, which is responsible for social protection for Jordanians, which was already overwhelmed itself and lacked capacities to provide social protection, for example, through case management to Jordanians. And so that was taken up into our own program, even though that was a protection concern that predated our intervention. Okay, so some of the specific urban challenges that we faced was duplication and coordination issues at a national level, but specifically also in the big city, where people tended to fall through the cracks. There is a system with UNHCR where it doesn't allow for duplication of the exact same type of cash assistance, but still it tended to be that certain families or households would be prioritized due to their scoring for multiple types of cash assistance with different NGOs, whereas some had never in those 5, 6, 7 years received a penny in cash assistance, and then were further and further removed from the services that are provided. And that's what I call this competition of vulnerability, where there are long waiting lists and a focus on the most vulnerable at the expense of others who are vulnerable, but in a different way, and where they just don't meet the increasingly stringent criteria for both cash programming and protection programming. Then I just briefly mentioned this as well, the pre-existing protection concerns, and this is basically mostly for the vulnerable Jordanian households that we worked with. The Jordanian population was the targeting happened through the Ministry of Social Development. And so those who, for example, did not have legal documentation or were not on the waiting list of that ministry also completely fell outside of the scope of this programming. And so the ones that we did work with were basically just the backlog of the government and fell onto our shoulders to deal with. And often with the type of long-standing social issues and criminality that we did not expect that we would have to be dealing with. Yeah, as I mentioned, urban structures were overwhelmed, even for the host community. Just for the sake of time, the spatial dimensions I can answer as a question in the Q&A session, because this was a specific question as well. And then the final point about tapping into other services, really it was a challenge to go beyond referral. You know, when people are referred for other services that were provided outside of MEDER, there tend to be long waiting lists and people would go into this big pool of referrals, but they still lacked the capacity to autonomously access solutions or services available to them without the NGO acting as an intermediary. So service mapping was a huge element of setting up this program to succeed, where people can independently go and demand access to their basic needs and rights without the involvement of the NGO, so that even after case management ends, people can rely on their own, on themselves to continue their growth and well-being. Thank you.
Great. Well, thank you again to both of you for such interesting presentations and contributions. We're going to start off looking at some questions that were submitted in advance. So the first question, which I'm going to turn to Heidi with first, is how can protection activities be linked to more durable solutions in urban areas? And particularly, can humanitarians link their protection responses to existing government or civil society social services? So we'll turn first and hear from Heidi, and then also hear from Angela on this one. Okay, we might have lost Heidi temporarily, so we will turn over to Angela and hear from you, Angela, first before, and hopefully Heidi comes back.
Okay, sure. Thanks, Leah. Well, I think I've already mentioned a consideration related to durable solution during the presentation. I mean, of course, durable solution is a key dimension of protection of displaced persons in generally, and it is so also in urban settings. Durable solution in urban settings, working for durable solution in urban settings require integrating the understanding that local integration is often the preferred options for urban IDPs. And this is important to keep in mind because, I mean, authorities in the first place, but sometimes also humanitarian actors, it sometimes end up having a sort of return biased approach to durable solutions. So it is important for humanitarians to be sure that we engage with authorities so that they facilitate local integration and avoid this bias towards return, because this could lead to I mean, people in cities want to locally integrate. They are missing support and not being able to rebuild their lives, and thus being feeling direct or indirect pressure to return to unsafe or premature circumstances. It's cities can also offer opportunities much more than rural settings of income generation, of employment. Of course, it is important to work to ensure that people have the necessary valid documentations to access to these opportunities and have the adapted skills. So here, for example, when it comes to people who move from rural to urban settings, we need to keep in mind that they may not have the skills that can be immediately used in an urban settings in order to access livelihood. And that's where humanitarians can, for example, intervene by trying to facilitate access to employment with vocational training, etc. And when it comes to linking the protection, our protection response to existing government or civil society social services, I could make the example of I mean, for example, what the ISSC did in Iraq, I mean, facilitating registration of vulnerable people, specifically was single women heads of households for state allowances. So you make the links with the existing government services that would be accessible only through payment of certain fees and only for those who are aware of the existence of those services. So there is an all work of awareness raising of existing services, information and support for the most vulnerable to be able to access those services.
Great. Thanks very much, Angela. I think we've got Heidi back on the line. So Heidi, go ahead as well.
Yeah, thank you. So in terms of durable solutions, I think one of the main things that we focused on in this project as well, because at the time the border between Jordan and Syria had opened, and there was this implicit push, not necessarily from the government and definitely not from UNHCR and the NGO community, that it was okay for people to return. But there was also widespread recognition among the working groups and the coordinating bodies that that is far from voluntary and dignified and safe return. And so really, again, I point to advocacy and the relationship with the state and the relevant institutions that decide on these things to maximize the recognition of the state of its role and responsibility to provide, you know, these durable solutions in the country. Because even when people were asked what their intention was to return, it wasn't as high as was claimed to be. And people were still looking for basic, you know, means of survival in the host community, to basic services in a non-discriminatory way. And so even those basics in Jordan were far from being met. But that said, we still had a few voluntary returns among our households as well, who had gone back to South Syria. And then our role in that as protection programming was to really improve the awareness of rights and the information. So for example, what is the necessary paperwork that you need to have in order if you do decide to return, and to really try and incorporate the support and the coordination of all other partners in that to make sure that we're all on the same page and sending the right messaging, protection messaging around returns, if that is chosen by the people that we work with.
Great. Thanks so much, Heidi. I'm going to turn back to you for the next question as well, because it really relates to what you were talking about in terms of the use of cash, especially in the Amman context, but also more and more all over the world. Cash and multi-purpose cash is being used, and so one of the questions we have relates to does the use of multi-purpose cash bring with it particular protection risks, and if so, how do we overcome those?
Yep, thank you for that question. So just as any other humanitarian intervention, multi-purpose cash assistance also brings risks in like the modality that is used and in the delivery. And obviously, cash in Afghanistan is completely different than cash in Jordan, where it's operating under a fairly predictable system where UNHCR had made an agreement with banks, and people very safely go and through an iris scan can retrieve the cash from an ATM. So, but still there is always a risk when there is increased access to a predictable flow of cash that makes people vulnerable to theft, of which we had a few cases as well. Then there's also the risk of disturbing the power balance in a home or a household, where, for example, if you like, who is the person who is physically taking the cash, who is making the decisions about spending the money, and who could potentially be denying access to this money from other people in the household who are affected. And one very difficult example where coordination comes in again in Jordan or in Amman was where multiple families who are from the same city, for example, would share a flat to save costs. and then due to coordination problems, they would only receive cash assistance as one household, and then there would be this protection concern about this money will not be enough for this number of people because they're technically multiple households, and what can that do to their dynamics, especially, for example, if it was a female single-headed household sharing with another family where there were men, for example. There are also data protection risks. So even with the iris scans, there are, if people could not for some reason take cash through their iris because of eye problems, people had ATM cards, and there is a data element there to bear in mind as well. The way to mitigate these risks, I suppose, is for cash and protection teams to work very closely together, from assessment to design to monitoring or post-distribution monitoring, to really understand what the implications are of giving cash assistance and how the cash is used. So designing explicitly standalone protection activities alongside a multi-purpose cash assistance is a very important way to mitigate these risks. And also designing a system of accountability, so training your staff on child protection and prevention of sexual exploitation and abuse, and also seeking accountability from third parties if they're not banks, but like third parties or middlemen who are responsible for distributing cash in more volatile or conflict affected areas would also be one way to mitigate these protection risks.
Great, thanks very much. A few of the questions that have come in advance also kind of focus on relationship with government institutions. And obviously in urban areas, we have a much stronger presence of various levels of government, which is one of the things that we always talk about in terms of urban areas. And so one of the questions is a bit broader, and it's how does the influence and existence of government institutions in the city affect how we address protection, and what kind of changes to the dynamic does this cause? And then in particular, what about in the context of interaction with local authorities or national authorities who might be present in the city and leading response or co-leading response in an urban area, who perhaps have different ideas around what response should look like, and perhaps might not be in favor of some of the things that fall within protection activities. And so how to kind of navigate those challenges that relate to the existence of an interaction with government authorities. So again, I'll turn to both of you, starting with Angela.
Thanks, Leah, for the question. Well, I think that definitely the fact that authorities are more present in urban areas creates opportunities, because I mean we all know that authorities are those who have the responsibility to protect people. I mean, particularly, I mean, to protect and assist internally displaced people, to work for them to achieve durable solutions. So they must be in the drawing seat of the response. So the fact that they are there, that they're present, and that they are willing to have an influence is positive. Of course, it comes with challenges, as you were also hinting. The first one is there is more control and regulations than, for example, humanitarian actors are used to when working in rural areas. They need also to be more conversant with complex legislative frameworks, and most importantly, the fact that we are facing a multiplicity of authorities. We may not, whose division of responsibility may not always be clear. So I think that one of the challenge here is to identify those interlocutors, those authorities with whom we need to engage regularly, because I mean dialogue with them is the most beneficial for the protection of civilians in that situation. And the key is, of course, to try to engage them in a constructive manner. So, of course, they may have different opinions in terms of what may or may not be needed. But I mean, the experience of the ISSC, that what is key is to try to to really understand the interest that are and also the motivations, and trying eh, to facilitate a dialogue that is based on sharing of experiences from other contexts, facilitating forums for peer-to-peer exchanges with other municipal authorities in other contexts, because this may indeed trigger a more positive dynamic of conversation with states, a sort of a peer-to-peer pressure that may help in overcoming some of the initial difficulties in dealing with issues such as, durable solutions, as we said, and other issues related to protection in urban settings. I know that Heidi wanted to also comment on this.
Great, thanks. Yes, we'll turn over to Heidi as well on this question.
Yep, thank you. So just more broadly, I guess the stronger influence of government institutions in urban settings is a real advantage that we can use to build capacity, to support in priority setting, coordination, streamlining at national level, and really strengthening, I guess, the relationship between the public and the private services that are available to displaced populations and the host community. But I guess also integration comes with risks, because what do you do when the local sort of authority or decentralized authority that is responsible for family protection or child protection has a different vision? What if they are punitive or under a military body? Does that align with your type of programming? And what are the gaps that then need to be filled? And do we have the resources and the time to build capacity? And kind of, yeah, this topic came up a lot of the humanitarian development nexus, and kind of handing over slowly but surely to national NGOs and national authorities. But it was found that actually the gap is still far too large. And like I mentioned, because, for example, in the Jordan setting, even for Jordanians, those government institutions were overwhelmed. And so it would fall on NGOs to find the resources to build capacity first, and then to be able to hand over some of this work in a productive manner. I think that's all for me on this question.
Great, thank you both so much. The next question relates to working in contexts where there's urban violence, and so particularly given, Angela, the case study example from Honduras, I'll turn to you with this one. Do you have any best practice or advice to suggest around operating in urban contexts where access is limited by criminal violence? And especially, how do you strengthen protection spaces for particular vulnerable groups, children, young people, and women within high-risk communities that are affected by things like gang violence?
Thanks, Leah. So I think that already during my presentation, I mentioned some of the learnings from the experience in Honduras, as well as El Salvador. I think that when it comes to operating in contexts where, urban violence, the presence of gangs creates problems in terms of access, but also, as I was saying, in terms of security and very, very serious do no harm constraints. I think that definitely the fact of being able to rely on trusted local actors as entry point, and as I was saying, to create a system for referral of cases and also support. It's key. In the experience of the ISSC, the fact of being able to count on the National Red Cross Society, for example, but also linking up to different social civil society organizations based on an understanding of what we we are able and ready to do, and what other people can contribute, can be of enormous help in both identifying cases of vulnerable IDPs that need specific and immediate support, and in making sure that the multiple needs of these people can be met. And definitely, I mean, the children, youth, women, they appear to be particularly vulnerable in this context. In Honduras, for example, they're definitely among the most vulnerable to displacement. So it is particularly important to inject age considerations, gender consideration in the way we try to approach people, engage with them, and especially in considerations related to defining a response that is tailored to their needs. For example, in Honduras, we more and more dealing with cases of teenagers, I mean, young, especially young boys who are sometimes compelled to become displaced because of risk of forced recruitment. And then they find themselves in a particular vulnerable situations because they are, I mean, they're separated with the rest of the family, and dignity for them also means being able to offer to them opportunities in order for them to continue the education, vocational training, to rebuild their lives also as much as possible. I think I was quite impressed, in fact, if I may expand a bit on this, by the fact that when hearing the presentation of Heidi, really what comes out is the importance of dignity and importance of looking at this interconnection between economic needs, psychosocial support needs, and protection, because this is all linked, and the holistic response to all those needs is what we need to really ensure the best protection to these people.
Great. Thanks so much, Angela. Coming back to something that you raised in your presentation, Heidi, you talked a bit about the spatial dimensions to protection. This is one of the questions that came in advance, and we've also had a related question come in live, so I'm going to kind of blend them together. Can you talk a bit about both the kind of spatial dimensions to protection in urban areas, and also in particular related to analysis? Do you find value in geospatial analysis for protection? And related to that, are there other sorts of data or analysis that you found particularly useful for doing protection work in urban areas? Over to you, Heidi.
Thank you very much. This is a super interesting question. Yeah, the spatial dimension was really a constant throughout this particular program. And I think some of this will apply more broadly or universally as well. The first was that proximity to service does not equal knowledge of those services and access to those services. So really, there was a gap that could not simply be filled by having those services available. Really, the unique relationship between the case manager and the households and the individuals in that household provided space for that complexity to come through. Because even if there is a service near to you, what makes it so that you cannot access it, or that you feel that you cannot access it? And these were things that came out that had a little bit to do with the spatial dimension, but also with the individual circumstances of protection risks, which I found very interesting. Another one is coordination efforts that are obviously influenced by spatial factors. So the division of an urban setting into various administrative areas, how does that affect people's access, and how does that affect how we are able to do our work with them? And so there was an attempt, or various attempts, to create a robust mechanism actually based on geospatial analysis and sort of geo mapping of services available, but that still lacked an indication of whether services were delivered or in fact reliable, and who they were available to. And so there were still many question marks around existing service maps in Amman and beyond in Jordan. which is also an interesting factor that we felt through our program we had to complement through our own service mapping, and also basic building on the knowledge of the people themselves, who often have complementary facts to our own, and we really learned a lot from that. Difficulties in accessing certain populations that are mobile, or for example who live in informal tented settlements, also affected our ability to deliver high quality protection services. People, for example, who lived between a camp and a home in Amman, or who frequently had to go back to sort out some paperwork with UNHCR or visit a sick family member in the camp, made it a little bit less predictable when we could do a home visit and, you know, the kind of follow up on this protection case management. The physical makeup of the city as well, it's quite hilly, there are a lot of stairs, and so working with people with physical disabilities also meant that we had to try and come up with creative ideas in how they could access services. Because if a child who is disabled and has difficulties walking up and down the stairs to get to school, and also the family does not have money to get a school bus, then you're stuck, right? And so these are spatial factors that influence the case plan and the priorities that come up in that, together with the families, which we couldn't have predicted if we had made it independently in the office. Yeah, so the learning here for us was understanding the spaces that people move in, and then making a very conscious effort to map that and to share that back to people for them to use independently, because cash assistance and case management was not going to last forever, and they would have to find means to independently search for and seek access to other services. A final note was also access on to areas that were known for like criminal gangs or clan violence, where it was even sometimes impossible for us to go in and do assessment in the first place, let alone do case management with them. And so that was one of the more difficult barriers to our work, where we had to hand that over to local services, government services. I hope that helps. Thank you.
Great, thanks, Heidi. The next question will turn to Angela. Do you have any thoughts about what's better or what's more appropriate for urban contexts in terms of whether it's standalone protection programming or mainstreaming protection across all sorts of programming?
Thanks, Leah. Well, I think that, I think that you need both actually. So there's not really one that is better than the other. Definitely there are specific protection concerns affecting people in urban areas, and in particular, because I'm speaking from an internal displacement perspective affecting IDPs in urban settings that do require specific protection responses. When you deal with problems related to obstructed return, forced return, and durable solutions in general, targeted threats, problems of stigmatization. You need specific protection responses. At the same time, I think that what has been said so far, both from myself and also very clearly from Heidi, you need to always keep protection in mind also when you put in place other types of programs, and the do no harm consideration, particularly as I was emphasizing in situations of, in cities affected by urban violence, must inform each and every phase of the response, from the identification of people, engaging with people, defining the response, implementing it, etc. And that's because the dignity and protection are also a result of as we were saying, being able to access the services, and being able to rebuild, to find autonomy, and to be able to normalize one situation. So it's much beyond, of course, physical safety and security. So I think definitely that both are a must, and I would say probably not only, this is valid not only for urban settings, but in for protection responses in general.
Great. Thanks very much, Angela. Heidi, another question for you. This one going back to cash programming in particular. Um, we've had a few different questions come in around kind of the risks around cash, in particular, a couple of different things, one potentially being extortion and potentially being in an urban area where activities are more visible. People might know where an organization's office is, or be able to kind of follow movements because there's patterns that they can observe. Are there risks related to cash programming in urban areas? And a related potential risk is the kind of existence of an extremely vulnerable population potentially in the urban area who might be quite desperate for support and might try to access the support when they might not be the ones who, the aid is targeted to, and how you kind of address that. So really around kind of the risks of cash in an urban area.
Thank you for that question. I'm assuming the question goes beyond the risk that I mentioned earlier in the modality, but there was still the question about risk of extortion. I mean, this is why case management was such an important thing, because that bridges that gap between simply just, like, for lack of a better expression, throwing money at someone and then not understanding how that affects that individual or that individual household's further their lives and their protection risk, and to make sure that it actually isn't doing any harm. And so through the case management, there is this intimate knowledge of this family is going to spend the money in this way. This family has a particular relationship with someone else who they owe money, and therefore it is a risk that once it's known that they are receiving cash, or even towards a landlord, what they might do to them and how they might extort them for further money. So it was also always a case-to-case decision of whether providing cash assistance is actually safe for a family, and also helping them as much as possible to have the means to mitigate those risks. So for example, if you owe someone money, do we need to put that as step one in the case plan to make sure that once that is settled, you can start then using this money for your own priorities that will not pose a risk to you, but will actually help you cope better with your current situation. I hope that answers that side of the question. Where in urban areas activities are more visible, that was very clear in the context we were working in as well, with many NGOs active, and almost all of them providing cash transfer programming. The demand is very high, and people's requests for cash assistance were never ending. And first and foremost, actually, UNHCR would be receiving those requests and then refer forward to other NGOs, whose response, unfortunately, was to make the entry criteria or the threshold for providing cash much more stringent, basically to be able to, because you can't meet the whole demand. There are hundreds of thousands of people in need of cash assistance, and therefore the entry point became those most vulnerable, who not only cannot pay their rent but also have a child in labor, or sorry, child labor case, very high debt, and a medical concern, a disability, a single-headed household. And you can even see that reflected in our program, because it was also a relatively small number of households, where it simply is not possible to absorb everyone into that, and that includes the host community as well. And I mean, the answer is kind of in the question in that one, where the vulnerable local population will also try to be included. And I'd say that's a good thing. And it's a good thing that in programming with refugees, that the host community is also explicitly included, and that's incorporated in policy. So any NGO wanting to do a program in this specific setting would have to also incorporate the host community. And I think that's a good way of mitigating the risk that you provide a certain service or do an intervention completely sidelining other people who are very legitimately in need as well.
Great, thanks, Heidi. And we might come back to a further cash question in a moment. Um, Angela, earlier in the webinar, you talked a bit about the kind of opportunities that can come with working in urban areas. And I wondered if you could just expand on this a little bit.
Thanks, Leah. Do you mean opportunities for the people who are actually going, trying to find refuge in urban areas, or also opportunities for humanitarians working in urban areas?
I think possibly both. I mean, I
Both?
guess,
Okay, perfect.
yeah.
Well, yeah, I mean, let me start by recalling that, I mean, during the study on during the case studies that were the basis of the report that we published last year. I mean, by talking to the people, who are displaced, they were displaced in those urban settings outside camps, it was clear that they had left to the city, not only, I mean, of course, to find protection, to find safety, for example, from military operations, but also because of the opportunity that a city may offer more than rural settings in terms of access to services and in terms of access to employment opportunities too. Now, the problem is also that these opportunities can be uh, taken advantage of if people have the right skills and if people have the document also to the official documentation in order to apply, for example, for a job, or to be able to register to school, or to be able to access medical treatment. So in this regard, I mean, as I was mentioning also before, it is really important to ensure that we try to in defining our response, we try to also, I mean, include interventions that may help specifically, I mean, particularly vulnerable IDPs to have access to those opportunities. I'd like to describe, for example, if I have time, tell me if the time is not enough, please. But very briefly, a project that the ICC implemented in Colombia on access to employment for IDPs in urban settings. And this is a project that was based on I mean, access to employment was guaranteed by partnership with private and semi-private companies. So it was about putting these people in contact with different companies, with potential, I mean, employers. At the same time, also offering vocational training, building their soft skills, because we were talking in the majority of people who had left from very remote areas in the countryside in Colombia and had arrived in Bogota, Medellin, Bucaramanga, and all this has had a very positive effect in terms of allowing people to have an easier access to employment, to also, if you like, break the isolation, because, I mean, of course, I mean, cities are an environment where social cohesion is less than in rural settings, and it may be difficult for newcomers to establish links. I mean, IDPs may suffer from the lack of social support and social networks. So uh, that was a very interesting and a type of interventions that managed to both address the issue of access to livelihood, but also to allow people to establish social linkages, and these also favored their efforts to rebuild and to normalize their situation. And of course, I mean, for humanitarian actors, there are more opportunities in urban settings, particularly because there are more actors that are present. And this, of course, I mean, Heidi also was mentioning difficulties in coordination, trying to avoid duplication, but uh, being able to count on a web of different actors is of course key, because the needs that need to be responded to are multifaceted, and it is important to be able to count on the different roles that each and every actor can play.
Okay, I'm going to turn first to Heidi and then maybe come back to Angela if you also have some thoughts on this one. The question relates to the challenges that might be faced when you implement mental health psychosocial support with IDP populations in particular, and whether this differs at all in urban settings or not. So over to you, Heidi.
Sorry, my answer would mostly not be about IDPs, but based on the experience in Jordan. And so the question is if it's different in urban settings to provide MHPSS programming. Is that correct?
Yeah, so well, I guess overall, what are the challenges that you might face implementing mental health psychosocial support services with, I guess, displaced populations more broadly then, and if there's anything particularly different about doing that in urban areas?
From my experience, there was nothing specifically about the urban setting that made that unique or different. But more broadly, like I mentioned, it was identified as one of the major gaps that had largely gone unattended for many, many years for people who were living in that same urban setting. And that also links to my comment earlier that just the mere presence of services does not mean people will take them up, does not know people know it exists, and does not know people understand what impact it could have on their lives. A large part of what we did was to even just raise awareness about what it means, and also to kind of raise the alarm about the need, because from assessment, it came out that the vast majority of people that we worked with, both adults and children, were not just assessed by us as being in need of PSS, but had voluntarily indicated their willingness to take part in PSS sessions. And the ones I specifically mean are group PSS sessions, where we referred almost more than 3/4 of our adults, and then a large proportion of the children that we worked with to another national NGO, which worked throughout the nation. But I mean, this is probably one urban element that makes it easier for people to access these services, where they had a walk-in center for children to do PSS services. So it might be the case in other cities or in other places where the urban setting provides more accessible PSS services. But I think for us at MEDAIR in Jordan, the biggest obstacle was actually responding to the vast need that is there, and also to raise awareness among the people that this is something that is immediately available to you, that might have a very large impact for you, and protection gains as well.
Great, thanks, Heidi. Angela, did you want to add to this one as well? Anything that you've faced as a kind of challenge with mental health support for displaced people?
Uh, Thanks, Leah. Maybe just a few words. Also, I'm not an MHPSS expert, but I can definitely support also the remarks, the comments that Heidi just made, in the sense that definitely, I mean, the sheer scale of needs of MHPSS needs can be one of the challenges. I mean, I remember being in Mosul and speaking with different peoples, and I mean, each and every of them had been profoundly traumatized by the experience of the war, and each and every of them, be the IDPs, returnees, resident, former IDPs, now residents who were hosting IDPs. I mean, everybody was in need of some support. And I mean, when you get at those proportions, then I mean, it's the entire social fabric that needs to be rebuilt. But it's also true that I mean, in cities maybe more than in other types of settings, indeed you can have more actors that are able to provide those services, which can be in the positive sides. From my side, maybe more than discussing the challenges, what I like just to emphasize is, I mean, for example, from our experience in Honduras or Salvador, so in context also of cities affected by urban violence, I mean, our experience is really that AMHPSS support is definitely an essential component of the response. And as I was saying, it is part of efforts to ensure protection in the longer term. People have gone to such traumatic experiences. We're talking about people who have been targeted by, I mean, I've been victims of targeted violence, from disappearances of family members to sexual violence, etc. And without this type of support, they will never be able, one, I mean, in the immediate moment after their displacement, to decide about, I mean, what to do with their lives, and to take the best the best decisions for themselves, despite the circumstances. And second, I mean, in the longer term, they won't be able to have the state of mind that is necessary for them to restore their autonomy, to rebuild a normal lives, and to access durable solutions.
Great. Thanks so much, Angela. So we've got 5 minutes left, so I'm going to ask each of our speakers one final question, and then we'll come to an end. For Heidi, a couple of follow-ups have come in just from some of the things that you shared earlier. The first part is, can you give us a bit of a 101 definition of case management? And can you also expand a bit on what you said earlier about competing vulnerabilities?
Yes, thank you for both these questions. The first on what is case management. Much like cash transfer programming, it is not a standalone type of program or assistance, but it's a modality. So case management is a way of organizing your work with an individual. So for example, a child in child protection programming, or with a household, like in this project that I presented, to achieve goals that are set by the person of concern themselves, also with dignity. So it's a modality, not a sector. And that is the one major sort of 101 thing to walk away with, that it's a modality, not a sector. And so case management, traditionally also used in social work, follows a plan or a pathway, if you will. The first is to identify and register people that might be eligible for your general programming, which in our case was multi-sectoral. So it was not a case management program, but it was a social protection programming that had different sectors. The second step in this pathway is to assess the needs of the individuals or the families that you're working with. The third and the most crucial one is to then develop an individual case plan, and that is done in complete ownership by the person of concern. So you don't walk into a household and say, I see that you cannot pay your rent, and therefore number one is to pay your rent, because they might say, actually, I'm pregnant and I'm due to deliver in a month, and that is my priority concern at the moment, which will come before even the roof over my head. So it's really listening to the needs of an individual person of concern and letting them lead the way and take the ownership, so that when you leave and you pull out with this plan, they can continue to adopt the tools that you have given them. And so in case management, it is very important that there is direct intervention, the direct action that I mentioned earlier, where the case manager sits down with the family, making it also accessible to people who otherwise would have needed to leave their house to access a service, like people with disabilities or elderly people. You go to them where they are in their home, and you give them the tools and skills to make better decisions for themselves and their children. So that's the case plan. Then step 4 is to start it and implement it. Step 5 is to follow up on this case plan and review it and reiterate it as you go. And usually that is most effective after a couple of months. And then step 6, which is the closure of the case, which might even be closing the case does not mean that all the objectives have been met. It just means that you're confident now to leave them to do it on their own. I hope that answers the what is case management question. And then to explain what I meant by competing vulnerabilities or competing for vulnerability. As I mentioned, the NGO responds to the vast need or demand and the limited supply of cash assistance and of programming in general in that context, was to make the criteria for absorption of people into programming very, very strict and very complex. And so the threshold to become a beneficiary of a program was insane. So someone needed to have so many different vulnerabilities and so many different compounded issues happening in their life to be eligible to a program. And that does not mean that people who do not score, 4 in the UNHCR vulnerability assessment framework are not vulnerable. It just means that they are not likely to be provided with services as quickly as others. And so if your programming is specifically focused on healthcare, then people with healthcare needs will be more likely to be absorbed. But in a program that is quite broad, that says, I will give you unconditional cash to do with whatever you please, then it becomes more difficult to, so it's a coordination issue really at the end of the day. It becomes more difficult to prioritize certain types of money or resources for certain types of vulnerability. If that does not make sense, please let me know.
No, that's great. Thanks, Heidi. So finally, we'll just turn to Angela with a final question about how, especially when we're talking about durable solutions, how we take into consideration the high burden that the host community might be experiencing because of the presence of displaced people, having to share scarce resources, the potential for conflict and even resentment that host communities might have for displaced people. So how we manage those tensions in the context of urban protection programming. Thanks, Angela.
Thank you very much for the question, Leah. Indeed, I feel that it's important to also spend some words on the perspective of host communities. And as you said, I mean, very often host communities are the very first responders and often also the only responders, because I mean, for IDPs who settle outside of camps, uh, they don't receive often I mean, support or sufficient support by humanitarian actors or authorities alike. So I mean, I think first of all, I mean, what is important to keep in mind is that, yeah, I mean, in order to avoid those tensions, I mean, it is important to make sure that those needs that are shared by both host communities and IDPs are also addressed, and that I mean, if in a city like Maiduguri, the population has become double or triple after the large influx of IDPs for the born state, then you need to make sure that the services and the infrastructures in the community are supported, rehabilitated, in order for them to be able to respond to the increased demand. It is essential, of course, to also make sure that once decisions to whom to prioritize in certain responses are taken, that criteria are explained, that not only IDPs but also host communities are have the possibility to take part in the analysis and in the definition of responses. I mean, from the part of the ISSC, we don't experience so much this risk, in the sense that we are not a displacement organization. So our mandate covers broadly all civilians that are affected in the situations of armed conflict or violence. So we try to assist and to protect based on needs and not based on the displacement situation in which people may find themselves. But of course, what we also see is that IDPs very often have specific vulnerabilities. That said, I mean, host communities also need to be looked at, and sometimes blanket responses, I mean, are useful. It's not that they are. When I said that one of the shortcomings of the response is blanket programming, it's not that these responses, blanket responses that address the needs of host communities and IDPs are wrong. On the contrary, as I was saying, rehabilitating services, making sure that host communities are supported in their efforts to facilitate integration of IDPs is key. what is important is that both the specific needs of IDPs and other vulnerable population and these shared needs are addressed as much as possible.
Great. Thank you so much, Angela. And thank you to both you and Heidi for sharing with us all of these experiences and answering so many questions today. Thanks as well to the majority of you who have stayed with us, even though we've run 5 minutes over the webinar. So thanks very much for your time. Thanks as well to Grace and Cara here with me from ALNAP. As I mentioned at the start, please do fill the survey out that's going to pop up on your screen when we end the webinar. It's really important we get your thoughts. Hopefully the fact that you stayed with us indicates that you've really enjoyed and gotten a lot out of the webinar, and we look forward to seeing you on the next ALNAP Urban webinar. Thanks again so much, everyone, and have a great rest of your day.